We often hear the term duty of care casually thrown around the workplace, especially in the aged care setting. But what does that actually mean? Well, today, that's what we're taking a look at. Hi, I'm Carrie from Culturally Directed Care Solutions, where we give you the knowledge and tools to provide quality care with confidence. Now, as a worker, you have a legal and moral responsibility to keep those people that you support, your clients or residents, safe from harm while they're using your service or in your care. This responsibility is known as duty of care. Duty of care is a legal obligation that we all have to take reasonable actions to protect or at least not cause foreseeable harm to another person or their property. Actually, in any professional relationship, there exists a duty of care. Your accountant, for example, has a duty of care to make sure that they're diligent when providing tax advice. Likewise, a teacher would have a duty of care to make sure that the children they supervise and teach on a daily basis get the education that they need and are kept safe while they're in their care. In the aged care or disability support setting, there's a professional relationship between the support worker and the client, and therefore there's a responsibility or obligation to not only provide an expected standard or level of care, but also to uphold the rights of a person. There's also an expectation that your actions or interventions are well thought out and minimise the risk of harm occurring to another person. The responsibility to prevent harm and to take necessary actions needs to be balanced so that it's respectful of a person's rights and wishes and reflects community, industry and legislative expectations. One example of this is the fine line between making sure a person is safe, perhaps making sure that someone with dementia doesn't wander away from their home or a facility, and restraint. Now, if you're unsure of implementing an action, then check first with the client or their carer, the client documentation, or your supervisor. Now, duty of care is a bit of a balancing act in the care industry because you have a duty of care not only to clients or residents, but also to other staff, to your employer, and to the general public. And duty of care can vary between the clients that you support. A client who has impaired decision-making skills often results in the care worker needing to provide a higher level of supervision and decision-making than perhaps when caring for, say, a frail older person who can make their own decisions and simply requires assistance with completing daily care tasks. When working with older people or younger people with a disability, the worker will have a duty of care toward them. This duty of care extends to volunteers who also work with clients, people such as those who deliver Meals on Wheels. It's expected that a person delivering a meal would make sure that the client receives their meal within the recommended time frame for delivery and also report back to the office any concerns they might have about a client. Of course, duty of care needs to be balanced with dignity of risk. We want clients and residents to have autonomy or independence over their everyday choices, because being able to accept reasonable risk in our life is important to a person's self-esteem and dignity. Staff can demonstrate duty of care by helping clients do what they want safely. For example, a client might want to go shopping, but they're at risk of becoming disorientated and lost and are therefore vulnerable if they go by themselves. To support the person to go shopping safely, a team member then might accompany the client so that they have a more enjoyable experience without the worry of getting lost. Other examples of fulfilling duty of care might include simple things like making sure that a client has eaten their meal and sitting with them to help them eat if they need that sort of help. Maybe it's accompanying a high falls risk person on their walk back to their room, or ensuring a resident gets the correct medication and that wounds are dealt with in a timely manner, as well as making sure that issues raised by the client or resident are addressed in a timely and appropriate manner. Sometimes duty of care and dignity of risk clash. For example, a client might decline to take a shower on multiple occasions when offered. Where there's no adverse outcome for not showering, perhaps the person prefers to have a regular wipe down rather than showering, and they're cognizant of their actions, then duty of care and dignity of risk is upheld. They make those choices. Where the person has dementia and perhaps they're also incontinent and they have a risk of skin irritation if they don't shower though, then care staff have to work closely with the client or resident to actively encourage them to take that shower. Ignoring the need for the shower in this second scenario would be negligent and a breach of care by the care staff. Now, one of the best ways you can reflect duty of care is to follow a person's care plan and let your supervisor know whenever you feel that it needs to be updated. The care plan is designed with the client or the resident, and it identifies what care and supports make the client's life better, as well as identifying their care needs. By following the care plan, you can reduce the potential of breaching duty of care and putting any of your clients at risk. So hopefully you now know how to uphold the concept of duty of care. We'll be talking a bit more about dignity of risk in a future video, so keep your eye out for that one. It will come out soon enough. While you wait for our next video, I highly recommend that you check out one of the videos here on the screen. We really enjoy creating content for people like yourselves, and I'll see you in the next video.